the standard neurodynamic test for the upper limb. We use this, when I would use this, is for when I'd use the stratigrade, it's for anybody with low back pain, anybody with lower limb pain, where I want to see if there's neural sensitivity. Upper limb tension test I use for anybody with neck pain, thoracic pain, or upper limb pain, or headaches. It's a very valuable, yes. I've got plenty of sensitivity in the upper quadrant, neck, thorax, or upper limb. Okay? Would anybody need to do an upper limb tension test? Who thinks they have neck? Is it your question, or you want to be... okay, good, okay. Where do you get your pain? Okay, and you are... Oh, okay, no, Sumed, that's his name's that long, so I'm going to go with Sumed. That's good, thanks, Sumed. Now, Sumed gets pain in the supraspinous fossa. Let's have a look at neck rotation. And the other one. Is that it? That hurts? Now, look how limited his neck rotation is. Now, he's obviously going to have joint signs, isn't he? But he very well may have neurodynamic signs. It is very rare that you will treat, it's very rare that you'll treat any musculoskeletal problem where there isn't some component of neurodynamics, some component of joint dysfunction, and some component of muscle involvement too. You just have to weigh up which one is the most positive. Now, looking at Sumed, can you see he's very limited in left cervical rotation? Very limited. He's got about 10 degrees. So that's very limited. I suspect he's got a lot of joint stuff going on. You can feel the muscle spasm too. But I'm going to see how much of that is neurodynamics, because there might be a neurodynamic component as well. Can you lie on your back for me? Now, this is probably when I'm teaching my postgraduate students, this is the technique that is done the poorest. What? Yeah, thank you. On your back, yeah. Thank you. Okay, so it was the left side. I'd always check both sides. So this is the one that really important to remember the numbers when you're winding up the neural system. You must make sure you're behind the coronal plane. So the elbow must be about 10 degrees behind the coronal plane. As you go up, you go to 110 degrees abduction. That's your first point. Do you get any symptoms? Then you go into external rotation. Any symptoms? Where's your symptoms? Already there. Okay, when I do that, does that change it? Okay, so you can see already he's probably got some of the worst neural sensitivity I've ever seen. He's already reproduced his symptoms here. Now, all I've done is take him slightly out of external rotation and that's improved it. Or I could extend his wrist already and see if that changes it. That increases it too. So there is proof already it's neurodynamic. And that's as limited as I've ever seen, which is really good for us today. It's good that he's so positive. He came prepared for us. So external rotation, supination. Now this is really important. This bit here, this is the thing that most people make a mistake of. Remember when you're doing upper limb tension tests, I'm just taking out of that because that's not pleasant. When you're doing upper limb tension test 1, what peripheral nerve are you mainly sensitizing? Median nerve. So you've got to make sure these two, the thumb and the index, are fully extended. Because I see a lot of physios do this. They have their fingers like this. That will make, you can get completely a false negative. You've got to make sure the fingers are completely extended. And if you have small hands, which obviously some of the females particularly have, make sure that you don't worry about these two fingers, because that involves what nerve? What nerve supplies it? So they can do what they like. So when you've got if you're a small hand on a big hand, make sure that these three fingers are extended. You don't have to worry about these. They can do what they like. Okay? I'm lucky because I've got big hands, so I can use all my fingers. But in other people, if you've got small hands, and that is a genuine issue, just make sure those three fingers are extended. So I'm just going to quickly go back. 110, external rotation, supination, full wrist and finger extension. He's smiling because he knows how much it hurts. Is that a bit easier? Versus here? Is it the same? Okay, so I'm still not convinced. I've got my hand resting on his upper trapezius because that is the first inkling of spasm. I go out until I feel increase, so that is always increasing. And now I'm getting a massive pull. Where do you feel that? Going down? Okay. And if you tip your right ear towards your right shoulder to increase the sensitivity, does that change anything? A bit more? Okay. So now he gets pain when you turn, or what hurts your neck? When you're looking down, so you shouldn't study as much? Okay. So he gets a sustained posture, so I'm going to do 3 movement. Now he is quite limited and I would imagine reasonably irritable, so I'm not going to do 3 pluses, I'm going to do 3s, 50% of elbow extension. Okay, you can feel that? Yep. Okay, so he's quite floppy, so I'm just going to stabilise him a bit more. Now I'm going to go 1 hertz, and remember I'm going to go for 90 seconds normally. And already I'm going a lot further out into extension. Yeah, no, I'm going further, that's why it's getting worse. Okay, now I'm going to see whether this makes any difference to his next movement. Remember he only had 10 degrees to see whether the neurodynamics has any involvement in his neck. Because I know it's positive, but that doesn't mean it's involved. Can you sit up? Glad that's over. So, can you again turn your head again to the left until it hurts? Already, you see how much better he's moved?
Yes.
And that shows you how much neurodynamics is linked with cervical spine. Now that doesn't mean we shouldn't be looking at his joints as well. You never just do one thing in isolation, but when somebody's got such limitation of upper limb tension test, and they've got such limitation of rotation, I want to see if the 2 are linked. And what I've already done is proven now that there is a significant involvement of the cervical spine and the upper limb tension test. There's neurodynamics. And the great thing is I could now give Sumit a home exercise, getting him to do it up against a wall. The same thing up against a wall, he should be doing every day. So again, can you see if I've done this, I've shown him how much better he's moving, can you see how much easier we're getting him to do neurodynamic home treatment? Because he's saying, look, if I said to him, look at how much better you are, imagine if you do that every day, how quickly you'll feel better. Thanks, Sumit. Thank you very much. Thank you.